Good afternoon. My name is Michelle Beasley and I am a BSN student with Morehead State University. Today we'll be doing a short presentation on my project paper for catheter-associated urinary tract infection reduction and prevention. My preceptor and I chose this project because of the past few months she has seen a rise in her CAUTI rates. Urinary tract infections are the most common cause of a hospital-acquired infection, with 80% of those being from indwelling catheters. In 2008, CAUTI was the first HAI chosen by CMS on the basis as not to receive reimbursements. The 2016 National Patient Safety Goals, under the reduced risk of HAIs, it lists the prevention of CAUTIs. The CDC recommendations for urinary catheter usage is patients with acute urinary retention or bladder outlet obstruction, accurate intake and output for critically ill patients, to assist in the sacral and perineal wound healing, patients requiring prolonged immobilization, end-of-life comfort, and selective perioperative procedures. Evidence-based risk factors include prolonged catheterization, female sex, older age, impaired immunity, and the disconnection of the drainage system. QSIN, or the Quality and Safety Education for Nurses, competency identified with this project was safety, as we want to minimize harm to our patients. We also brought in evidence-based practice as we want to integrate the best current evidence to provide care for our patients. We use data collection as to monitor outcomes of the care processes, and we want to improve improve the methods used for the quality of care. Teamwork and collaboration was also brought in. It includes the nursing staff, providers, and the interdisciplinary team. The best practice prevention for CAUTIs is staff education on appropriate indications for urinary catheterization, risk factors for CAUTI, aseptic technique, and the use of checklists and audit tools. We came up with 4 different types of audit tools. The first one is the urinary catheter reminder sheet, which is a sheet that we will put on the chart. It will be on there daily. Actually, a new sheet will go on there daily, and the physician or the nurse will identify if the patient still meets the criteria for the catheterization. If not, then we would recommend that the Foley catheter or urinary catheter be discontinued. Or we could flag it in the EHR, such as using automatic stop orders or some kind of other flag that would remind the doctor that yes, this patient has a catheter. Does the patient still meet criteria? Do we continue or do we discontinue? The second audit tool is a urinary catheter insertion competency checklist. This involves having 2 people who need to put in a catheter. The first person will put in the catheter and the other person will be there as a monitor, and if they see that there is any break in sterile technique, they will stop the procedure and the nurse putting in the catheter will have to start all over with a clean, sterile set of catheterization tools. The third is the urinary catheter daily tracking sheet. This looks at the data for insertion. Was there an order in place? Did the patient meet the appropriate criteria for the catheter, etc. The last checklist would be the bundle. It's called the catheterization bundle checklist. It looks to make sure that the catheter securement has been in place and is accurate. Hand hygiene is performed before and after catheter maintenance and manipulation. The closed system has remained intact, etc. The goal of this project is to provide training and to have audit tools in place to effectively reduce the number of urinary catheters inserted and to decrease the CAUTI rates. I thank you so much for your time on viewing this YouTube video. Thank you.